that provided me with quality health insurance, because if for any reason I wasn't employed by an employer that provided health insurance, an insurance company could refuse to cover me because of pre-existing conditions. So when the Affordable Care Act passed, that made a big difference in my life. And I'm grateful for the Affordable Care Act, and I recognize that it needs to be better. So my story is awful, but it is only one example of the ways in which insurance companies play games with our lives at our most vulnerable moments. Some people die because they don't have access to health care. And this, as we all know, is unacceptable. I worked as an organizer for healthcare reform from 2009 to 2010, and then to maintain the Affordable Care Act thereafter. And I went all around the state of Missouri talking with people. We went from one county fair to another one summer, and we started out by asking people, do you have a healthcare story? And after about one fair or two, we realized that we were asking the wrong question of people. We didn't need to ask, do you have a healthcare story? We need to ask people, what is your healthcare story? Because everyone has a healthcare story. Did you receive an insurance statement or an explanation of benefits in the mail that you didn't understand? Did you give up trying to distinguish the difference between plans because it's like reading a language that we're not fluent in? Do you not have insurance at all? Did you pick a job based on the health insurance coverage it provided? Did you choose not to go to the doctor because of a high deductible or some other reason? The list goes on and on and on, and the point is that all of these challenges are products of a system that is meant to confuse. It is meant to make us feel inadequate. It is meant to make us feel ashamed and to be silent. But I think we all know that the true shame is in companies and CEOs that value their profit motives above human lives. And we also all know that we can do better. Now, Margie and Jim are experts, and they'll speak about the practicalities of how we can do better. But I want to close today by emphasizing do better. Healthcare is one of the great moral and ethical crises we face in our country. I believe the crises we face in this moment beg the question, do we value people above profits? And I know our answer to this question. I believe our future and our children's future depends on how we collectively will demand that the only acceptable answer to that question is yes. Yes, we do value people above profits. Yes, the health and well-being of people is more important than the wealth of corporate CEOs. This morning, I got to hang out with 3 children who were between the ages of 3 and 10. We played dinosaurs and Beanie Babies, and we sang songs. And the greatest worry we faced while we were playing was whether T-Rex was going to succeed in eating the lizard or not. Now, we all know that the list of the worries these kids face will increase as they grow older and eventually become grown-ups. Health will probably be one of them, but health care, their access to health care doesn't have to be. I left these stickers on my hand today to remind me that we must do better. For ourselves and for our children, we must do better. Securing improved Medicare for all is one essential way that we will stand for that great Paul Wellstone quote. We all do better when we all do better.
from Michigan United. She's going to tell her healthcare story.
Can I say something really quick?
Sure.
Well, look, we're all here because we're all on the same page on this.
Right.
And so, preaching, these stories are important, but we're preaching to the choir here. So I think we need to focus on political strategy. For example, Bernie Sanders just introduced national health care legislation. Elizabeth Warren signed on. We got to get Debbie Dingell to introduce a similar bill in the House. If she won't, we need to run someone against her, and we need to run someone against Wolver. I mean, let's get
Yeah, I agree with you there. Yes.
Thank you so much. We actually have plans for exactly what you're talking about. And once we're done with the town hall portion, we're going to get you signed up. One of our leaders, go right to Stadenow's office and right to Peter's office, and you can lead us to Wahlberg's office, and we got a lot of other stuff to sign you up for.
We were with Peter's office this week and did exactly that same thing.
Oh, we're coming
And
back.
you have got to sign on to that legislation and bring Bernie into Michigan and walk beside him, saying that you're going to work with him. So yes, we need everyone.
I absolutely agree with that. Absolutely agree with that. Thank you so much for that. I'm an organizer, and I'm going to share my story. And I do think that being organized and building grassroots people power together to push policy change is the exact thing that we need to be doing. We need to be taking action. But I do want to say that storytelling is a way to take action because it changes the narrative. So I think always centering stories in anything that we're doing and being grounded in people's lived experiences is really essential to changing the dominant narrative and getting in your gut about why we're doing this and then sort of pushing us to action collectively. Thank you for sharing that, and I'm going to briefly share my personal story with you. My name is Laura De Palma. I'm an organizer with Michigan United, and I have been dealing with a health issue for over a decade that is a pre-existing condition. So in the year 2009, I was diagnosed as having bipolar disorder, and I actually had to take a lot of time off of work for treatment. And eventually, there was a point in which I was both dealing with mental health and back surgery. I had 2 herniated discs. And so I was dealing with both things simultaneously, and I actually had to leave my job after having a major back operation because I had to actually rest for 6 months. And the job that I had, I was probationary, so they didn't actually take into account medical leave. That wasn't an option, and I did talk to my union about seeing if I could stay on, and they're like, you don't actually have rights right now because you're a probationary employee. So if you do need to take time off after your back surgery, you just are gonna have to do that. And so I actually left California where I was teaching to move back in with my parents to literally heal from the back surgery. And then I realized that, the next job I get, I could get health insurance with that job, but I have a pre-existing condition, and certain things will not be covered. When I was in Ohio in 2012, working with Obama for America, organizing around the 2012 election, I did have health insurance, and I did need services, and I was told, you are going to have to pay for those out of pocket, and I was billed for an extraordinary amount of money around lithium and things that I needed to be on, and I'm still paying payments on that, those services that I needed in Ohio. And so for me, I'm an organizer. My job changes every 6 months, or it used to when I was jumping from electoral campaign to electoral campaign to electoral campaign, jumping from one healthcare provider to the next. So this is an issue that really runs deep for me. It really grounds me in why I'm doing this and why I'm fighting for it. And I do believe we need to mobilize to collective action. And I feel really grateful to have the space to share my story and to be grounded in it. Thank you all for being here and for joining the fight.
Jim Mitchner. He's an ER doc at St. Joe's in Ann Arbor. He's just going to say a few words about why he's here.
Actually, I'm sorry I'm late because I was actually working today. So
Yeah.
occasionally doctors have to work on weekends and all that. Well, welcome everybody. Thank you for coming. I'm glad that we're doing this because, as you probably know, single payer is basically a grassroots phenomenon. You know, you're never going to be able to raise or spend the money to go up against the big pharma and the insurance industry. Between the two of them, they have about 3 lobbyists for every member of Congress. So, and they spend billions of dollars every year, you know, lobbying against things like this. And if you believe that every American is entitled to health care as a right, not as a privilege, if you believe, like those of us who work in the ER do, that everybody is entitled to the same kind of care regardless of their income, their job, their insurance, what their immigrant status is, etc., then the question is, what's the most efficient way to pay for it? That's basically what single payer is. It's just a more cost-efficient way to pay for universal health care, which actually, if you do polls among American people, they believe in universal health care. They believe that everybody's entitled to health care. This is why we don't biopsy somebody's wallet when they come into the ER. We basically take care of them. And if you believe that, then what's the most efficient way of doing it? And that is to single payer. Insurance companies are enormously inefficient. When they get a healthcare premium dollar, they immediately lop off 15, 18, even 20% or more right off the bat to pay their administrative armies of actuaries, accountants, lobbyists, lawyers, quality experts, case managers, claims adjusters, and then of course you have the dividends for the shareholders and the outrageous CEO salary. So what's left is about 80 to 82, 85% at the most on the dollar to pay for actual health care. And what kind of business are insurance companies in? What's the primary business objective of a for-profit insurance company? Make a profit. Right. Okay, so how do you make a profit? Well, you collect the premium and you hang on to it as much as you can. You make it harder for patients to get care by putting them in narrow networks, or by restricting what things they can get, or by paying doctors less or late, and the same thing with hospitals, that they make money on the float. They get the premium, and they hang on to it as long as they can. So is it any wonder that so many physicians in the country now are frustrated dealing with all these different insurance companies? Burnout is at our all-time high among doctors, and part of the reason is because they're just getting fed up with the paperwork. And fighting for patients is like a full-time job for them. And it's no fun. I mean, it's hard to enjoy the privilege and the joy of practicing medicine when you have all this paperwork you got to do to get it done.
Thank you so much.
To respond to the gentleman who said that we need to get organized and have a plan. Yes, we do. And I am delighted that you raised it. But I have been in this since 1990 and worked with other states who have come fairly close to doing it. We need to be prepared for those millions of dollars that will be out there scaring the bejeebers out of our friends and neighbors about why this is a bad thing, which is why I think we need to prepare ourselves to answer the questions. How many of you were as depressed as I was at 3 a.m. last night when that passed and its effect on health care? We now, in this country, are in a place where by public policy, we are killing people and causing suffering. Public policy. And we have to be willing to name it for what it is and not allow people to tell us that this is a wonderful thing. It is not a wonderful thing. People are going to die and people are going to suffer. And unfortunately, a lot of them are going to be seniors. So I just want to make sure that people are armed with understanding what we're going to be coming in. Not that that should curb our enthusiasm or we shouldn't do it, of course not. But let's get, God, I don't want to say let's get a win. That sounds like something I've heard. But if we really want to achieve universal health care, we have to tell the stories, we have to have people's hearts, but we also have to be thinking about what they're thinking and how they're going to come after us.
Right. Thank you, Margie. So our coalition put together some key points that may help us in canvassing town halls or conversations with our legislators, especially when we're pushing HR 676 or Sanders' bill. I also have some slides from Physicians for a National Health Program. This is a group of doctors who have been fighting for health care since 1987, so they've been in the fight for a while too. That's just a brief overview of that. We believe the right to health care is the right to life, liberty, and the pursuit of happiness. Health is not a commodity. It should not be bought and sold for profit. Healthcare is a need and not a want. The Universal Declaration of Human Rights says, everyone has the right to a standard of living adequate for health and the well-being of himself and his family, including food, clothing, housing, and medical care, and necessary social services. And we believe that a single-payer healthcare system is a step in that direction. And as you can see, even after the ACA, we still have racial and ethnic disparities in rates of adults who live without care because of costs. So working families of four now average over $25,000 a year for health care in 2016. In 2001, this cost was $8,414, so we see this cost has been rising every year. Employers paid an average of $14,793 per family of four every year, while employees paid an average of $11,000. This is not including the health care costs included in auto insurance and homeowners insurance on top of that. The taxes needed to fund an expanded and improved Medicare for All program would be less than what 95% of Americans currently pay for health care costs. So that's why we should go for it. When you're broke, it's easy to think away that chest pain or ignore that growth, especially if you're concerned about money and thinking about your family and the costs that you, like the just basic living costs. We think a single-payer healthcare system would have a ripple effect on other costs. Everyone in, nobody out means more bargaining power. Our taxpayer money already pays for 2/3 of all healthcare costs in this country. This is like for Medicare, Medicaid, VA, subsidies to employers, tax breaks, and buying private plans for government employees. So we're already paying for a single-payer healthcare system. We just don't have the benefits. With a single-payer system, we would have free choice of healthcare providers. Every provider will be in network, no more refusal of care because you're out of network. Single-payer plans proposed include higher reimbursement rates than currently received for Medicaid or Medicare, so that's great for healthcare providers. Private health insurance companies providing duplicate health coverage services would be prohibited. So we would all be in the same system and have that bargaining power to make it better. We believe that expanded and improved Medicare for All would be most efficient and least expensive. The U.S. multi-payer healthcare system is inefficient. We spend far more than any other developed country on healthcare. In 2016, our country spent $3.2 trillion on healthcare expenditures. The U.S. has worse health outcomes than other developed nations with universal health care. And poor health can be traced to lack of affordable access to preventative treatments. And as you can see, average life expectancy for people in the U.S. is lower than other countries with universal health care like Germany, UK, Canada, Sweden, France, and Italy. And I think this is a big indication of our quality of health care. Infant mortality rate is also higher in the U.S. than those other countries. And we see a huge difference in maternal mortality, this is just showing deaths per 100,000 births. So we're not taking care of our mothers with this current healthcare system. A single-payer system is the most efficient and least expensive way to cover our healthcare costs. Only by enlarging to the largest possible pool can the risk and expenses be spread widely enough to eliminate cost sharing. Having the largest possible pool will also allow for huge renegotiation of drug and equipment prices. Health insurance providers are still making record profits. The first quarter of this year, Humana, Anthem, Cigna, and United Health all made record profits. A single-payer system would allow healthcare providers to focus on healthcare once again. Instead of, physicians right now spend an average of 40% of their time dealing with paperwork and fighting with insurance companies for certain medications or services to be covered for their patients. Use of a single-payer provided chip card and no copays or deductibles would massively reduce administrative overhead costs for doctors and hospitals, saving us all money. And this is a chart from PNHP just showing how much that doctors spend twice as much time on desk work as with their patients. A single-payer system would give us freedom from job lock. When someone wants to leave a job but cannot risk being without the benefits of their company or organization, this type of healthcare system would be a major boost to entrepreneurship, small businesses. Basically, that they won't have to focus on providing health care for their employees. 2008 Harvard Business School study showed that 11 million people were caught in job lock tied to health coverage. That was in 2008. So that's probably higher now, I'm guessing. Okay, so a single-payer system would give benefits for employers because, like I said earlier, employers kick in over half of most employees' plan costs. About half of the work of HR departments is dealing with health plan benefits, so we would see a huge savings in overhead with a single-payer system. And the healthcare portion of workers' comp would also go away under this system as well. And this would allow employers to focus on business instead of putting time and energy into health benefits. The next point is that single payer would be great for unions. We no longer would need to negotiate for health coverage benefits, and unions can get back to negotiating wages, pensions, and working conditions. A huge one for nurses is patient-staff ratios, because we've been getting more and more patients, so that's definitely a concern for nurses. And HR 676, which is the expanded and improved Medicare for all, has been endorsed by 633 labor unions. So they're behind this. A healthier population would equal a stronger economy because the single-payer healthcare system all would be covered, so we would have a healthier population. Productivity losses linked to absenteeism cost employers $225.8 billion annually in the United States. This is about $1,685 per employee. So focus on prevention will cut those costs. Healthier workers are more productive, earn more, and are able to pay more in taxes. And over 60% of bankruptcies are due to medical costs. And then we see these nations with better health outcomes. They have universal health care. Why don't we? The lobbying power of the insurance and pharmaceutical companies does not exist in other developed countries as it does here. Profits continue to rise in these industries while our premiums and deductibles also continue to rise. So like Margie was saying about I'm sorry, I lost my thought there. Continue. And then there's a myth out there that the free market works best. We do not see a trickle-down effect. Like our prices just keep going up. The premiums and deductibles continue to rise while health coverage industries make record profits. This is just a slide showing that health insurance company CEOs are making tens of millions of dollars per year while workers and poor people are struggling to afford their health care costs. And we're also spending more and more on pharmaceuticals every year. These are just my family members, a lot who are on Medicaid and Medicare uninsured, and that's kind of like what got me involved and had me realize like how unfair our healthcare system is at this time. So now we have a few people running for office who would like to talk about their support for the single-payer healthcare system. We have Michelle Dietrich, Washtenaw County Commissioner. Welcome and thank you for helping us get this space today. If you would like to say a few words.
Well, thank you so much to the organizers. Like, could everyone help organize and set this up? Like, raise their hand and thank them? Yeah? Thank you. And thank you to the panelists, and thanks for the opportunity to speak. Yeah, I'm a county commissioner. I'm also a poet and a farmer and a former policy analyst. So all that will go into what I want to say. You know, we all know that the inequities are destructive. They're tragic. Rich people are living longer, have access to cutting-edge health care in this country, while other families pay for inadequate health care or still can't afford it at all. And now we have the Senate bill that Margie spoke about, that passed last night at 3 a.m., and it would repeal the individual mandate of Obamacare, which doesn't repeal all of Obamacare, but it means is that healthy people will leave the system and premiums will rise. So it will do a really good job of destroying Obamacare. So that has not yet passed in the House, but and the House tax bill is different, but everyone I'm reading is saying that it's likely that that will actually happen. So. So I've been a supporter of comprehensive single-payer system, one that's fully public, with coverage for dental, vision, mental health care for over 20 years. That was when I married a Canadian, so there's a correlation there. And I supported it in California. I supported it as Bernie's first hire in the state and as a grassroots organizer for him before that and since. I'm going to keep on supporting it. It's a very personal thing for me, and I'm going to share a story quickly. Partly because I think it really does point to the strategy a little bit about how we can get where I think we all want to from here. So 8 years ago, 3 women who were very dear to me, strong, powerful, wonderful women, my mother, my mother-in-law, and my mother's mother all died in a 6-month period. So I had a lot of experience. Yeah, I was like, worst 6 months of my life and lots of other people's, but you know, I had a lot of experience of the healthcare systems. And my grandmother died in California of a chronic disease. She was put in a private nursing home because of her chronic disease at a tremendous cost to our family. We were unable to prove she was a citizen, and so we had to pay for it. Didn't get Medicaid. The staff there was underpaid. The quality of care was terrible. There was definitely a case of profits over people, and she died of an untreated bed sore of sepsis. So in contrast, my mother-in-law, who lived in Canada, She was taken care of in her apartment by doctors and nurses who visited her there until 5 days before her death. She chose her own pain management. She chose when to go to hospice. She was taken there and treated wonderfully, and death is never something we welcome, but it was a death that I would have chosen for her and that she would have chosen for herself. So I favor the Canadian model, which is a fully public model, unlike some of the others that we see in countries like France or Germany, where you have a mixed public-private. It's worked for almost 50 years in Canada, since 1968. And one of the things that excites me about what I believe Michigan United is about is that the Canadians started in one province. It started in Saskatchewan, which is surprising if you know Canadian politics, but, and they got it in '62, and there was a fight. There was a fight with a lot of doctors, and there was a fight with the health insurance companies, but it worked so well, it spread really quickly, and by 6 years later, it was over the whole country. And there have been changes in the law since then, fine-tuning, and you've read the horror stories. No human system is perfect, right? It's not a perfect system, but it's pretty damn good. Canadians live longer, they have less inequity in healthcare. Per capita healthcare expenses are half of what we have in the US. So I'm going to talk just briefly about Washtenaw County, what we face here, because I've become very aware of that as a county commissioner. We're sort of like a microcosm of what we've got in the state and in the country. We have huge disparities in healthcare access and availability, geographically and racially. White residents here live an average of 75 years. Black residents live 62. There are lots of areas with limited or no health care and where people without transport can't get to it. We have skyrocketing opioid abuse rates, especially heroin, and that's countywide. So, you know, if ACA is destroyed, obviously the county, we provide public health services. That's one of the things the county does. We're going to have to step up. And where we'll get the money, well, that will be our job, and we'll do our best. But we're really limited by the state government and what we can do about raising taxes. So it's going to be very, very tough choices to make. So I want to give you one quick example of the problem in Michigan with access to health care. So every county in Michigan has a veterinarian. 22 counties have no OBGYN. Right? So I love pets, I love animals, but I love babies too, and I love pregnant moms and women. So, so obviously the healthcare issue is also a bigger one. I mean, we need universal health care, but we also have to have clean air and clean water and clean soil. We need to have places for physical activity. We need safe housing. And as a county commissioner, I've been an advocate for increasing access to health care and especially mental health care. Many of you know about the millage that we got passed, and I'm really hopeful about what we'll be able to do. I was also with other commissioners able to get a measure passed that will should enable us to raise the wages of the people who provide the health care. On average, they make, on behalf of the county, on average they make less than $10 an hour. So we want to raise that, because what it means is we have incredible turnover. Some of the providers have 100% turnover annually, right? Or they can't fill positions. So it's wrong to treat people that way, and it also affects quality and continuity of care. So it would be a win-win to raise these folks' wages. So I think I'm probably at the end of my time, so I'm just going to quickly say I've done lots of other work as county commissioner to improve healthcare in the county. I'd be happy to talk with you individually about it. And I believe that the right to health care should be enshrined in our state and our federal constitution. It is a right, not a luxury. Thank you.
Okay, thank you, Michelle. Now we have Anuja Rajendra. She's a businesswoman and entrepreneur, and she's also running. Thank you.
Good afternoon. How are y'all doing? Good. I'm Anuja Rajendra, and I was born in the Lansing area. I'm a daughter of immigrants. I have lived here for most of my life, and my parents didn't have a whole lot when they came here with a suitcase and $100 and a dream for a better life. And I was separated from my family for the first 6 years of my life. So I understand what it's like for families to try to get a meal on the table and much less think about health care. I went on to study engineering at the University of Michigan and got my graduate business degree as well. It says here I'm a businesswoman and entrepreneur. We're all more complex than one role that we have. I have worked in the nonprofit sector, in the private sector, and been a small business owner twice now. And both times has been focused around improving the mental and physical well-being of people in our community, specifically in Southeast Michigan. And I want to tell you a story about healthcare. I know that we talked about whether or not those stories are important or not, but I think, as we said, changing the face of healthcare is really important, and who needs it. So after I delivered my second son, and I'm going to embarrass him, he's here right now. He's my Michigan man, Kabir. There were a lot of complications. He was born right here in Ann Arbor. I'm a pretty healthy person. And even though intentions were good, I was given a less than optimal dosage of opioids, which led to a series of complications, had me in and out of the ER for almost a month, and I was between the St. Joe's Annex, the main St. Joe's Hospital, and the University of Michigan ER. So instead of nursing my son and taking care of my 18-month-old who was at home, I was literally fighting for my life. They thought I was having cardiac failure, my oxygen absorption rate was plummeting, my blood pressure was really low. I might not have been here. And we were very lucky because we had health care through my husband's job. And I know that's not the case for a lot of people, even in Ann Arbor, even in District 18. The story could have been very different. As a small business owner, I understand the other side of that. It's not that small business owners don't want to take care of their employees, because if they don't have healthy employees, they can't operate, right? Who's going to do the work? I believe in the intentions of most Michiganders. We do want to take care of our people, but the cost and pressure of keeping the lights on and making payroll when they have the added health care pressure makes it really tough. So we need a new way, and that's why we're here today. And we need to have pragmatic approaches. I'm an idealist, and at the same time, I'm I'm deeply rooted in my values, and I'm also wanting to help us move the needle. So how can we do that? We start with a basic premise that healthcare is a human right. I'm in complete agreement with that. No one should be denied because of their income or pre-existing condition. And I'm telling you that as somebody who has always had healthcare because of my parents or my husband. Healthcare has to include elder care, it has to include pharmaceuticals, and it should be managed in the nonprofit sector because a person's health and well-being should not be profit or loss on a balance sheet. So we need to replace the for-profit approach with an inclusive, humanistic approach, like in Canada. It works humanistically and economically. And we have to make sure if we're going to sell this, if we're going to bring people on board with us, right? Because no one legislator can do this alone. And if they tell you they can, they're lying. It takes all of us. It takes this collective energy, this movement, in order to make something happen. So we have to approach it from both perspectives, humanistic and the economic. So before decisions of this magnitude can be made, we have to make sure that we know what we're doing, and let's build the case for it. We need that pragmatic approach. Let's introduce a study bill to examine the alternatives, the costs, and benefits of ensuring that all Michiganders have health care. We know they do. We know it makes sense, right? So let's put the data before the people, before our Michiganders. I believe that our Michiganders will respond. And we're not going to be a room full of 30 people trying to do this alone. They will respond. And when we take the labels off of healthcare, stop it from being a progressive issue or an anti-Republican issue, when we make it a humanistic issue, our Michiganders will respond. I've lived in this state for most of my life. I know they will, and I know that you know that too. When we go back and talk to our families and our friends, this study bill should also address the job losses and alternatives to protect workers and the local communities from the economic impact of those job losses. Such study bills have passed in other states. And just for the record, they've come out in support of what we're trying to do here. So let's not be fearful of that approach. In Michigan, a long-term elder care study bill is under consideration in the House. This has bipartisan support. And I believe that health care would be seen similarly in a bipartisan way. It would cost about $300,000 to $400,000 with a combination of public and private funds to get it passed. The other thing that I want to talk about that we need to address immediately is the Healthy Michigan Plan, the expanded Medicaid in Michigan. So when legislation to accept expanded Medicaid in Michigan passed, it included an amendment that will auto-terminate it when the cost of the program exceeds the savings in Michigan. Did you know that? A lot of us don't know that. So, if the federal government cuts the Medicaid subsidies, the auto-termination happens immediately. Even if it doesn't happen, because the federal funding will go from 100% to 90% in 2020, the auto-termination is projected to happen. So let's make sure we keep this on our radar. So I'm running for the Michigan State Senate District 18 because I know we can do better. I've worked in my life to build coalitions with people to move the needle. Okay, and I believe in Michiganders, but it has to be something that comes from the people. We can't walk into a room with an anti-Republican stance, saying no to everything just because they're Republican, and call it a progressive, bill. It's a humanistic bill that makes sense for all of us. Let's sell it to the Michiganders, because I know they will respond. I can't do it alone. And I need all of you with me. But if you've sensed anything about my energy and my determination and my work ethic from this conversation, I invite you to join me in this fight. Let's do this together. Let's achieve this. And it was, as was said before, let Michigan be a beacon of light for the rest of the country. I know we can do better. Let's do this together.
Thank you. They're running for state senate, by the way. I didn't clarify that. Then I have Jeff Irwin. He's a former state representative for Ann Arbor. If you want to come up and say a few words.
Thank you everyone for having me, and thank you all for coming out to support this important issue. I think, like the two candidates before me, you'll be unsurprised to hear me stand up here and say that health care is a human right, and I believe that every American should be able to go to the doctor when they're sick and get the care they need, or go to the doctor when they need preventative care to make sure that they don't get sick. That, I think, is going to be a fundamental you're going to see across the board here in Washington County, which is one of the reasons why this can be an epicenter of the kind of activism and involvement we need to spread across the state. So, no question, health care is a human right. I think if we were to look at the amendments to the U.S. Constitution, I don't know, maybe it's time to get rid of the piece about quartering soldiers and we could replace this right there. That would be a nice small number, we could put that up there, but then again, I don't have any room in my house for any soldiers, so maybe we shouldn't play with those first 10. Having said all that, obviously I'm a supporter of this issue for a lot of the reasons that folks mentioned before. It's the humane choice. It's only the right thing to do that's ethical to our fellow citizens. Also, because it costs less. It's more efficient. We can get better outcomes for less cost. And that's what all of the other countries around the world, all the other industrialized nations around the world are already doing. And in the process, they're eating our lunch in terms of entrepreneurship, and we heard a little bit about that. We know that every time we go to buy an automobile, that our American-made, union-made cars have to compete against cars with lower healthcare costs on the sticker price. So we know here in Michigan that having a broken, expensive, two-tiered healthcare system where the rich have access but the poor do not is hurting our country both morally and economically. So we all agree with that, and we're all going to support politicians who stand up for that, and we're all going to press those who are running for office and those who hold office to live true to that value. And as you see here in Washington County, there's going to be a number of folks who are going to be asking for your vote next August 7th. I'm one of them. I hope you'll consider voting for me. And I hope that when you look at those candidates who are seeking to have leadership here in Washington County, specifically with respect to health care, you look at our records on these issues. So I've been involved for a long time, and I first came into contact with the health care issue back in the 90s, not quite as early as Steve. But a little bit after that, when I came here to the University of Michigan and got involved in studying political science in the wake of the failure of the Clinton healthcare debacle, we'll call it. And through that process, I had a chance to study the heritage conservative Republican plan that ended up becoming Obamacare, and I got a chance to study the systems around the country, and I got a chance to learn that they do a better job in Canada, they do a better job in Great Britain, they do a better job in France or Germany. Personally, I like the French and German systems. I think that they get the best outcomes. But I think there's a lot to be said of the British system and the Canadian system as well. So any of these would be a good place for us to move to. And I have had a chance during my life to be a public servant, and every one of those opportunities, I've tried to move us closer to those ideals. So for 10 years, from 1999 to 2010, I served as a Washington County Commissioner. We worked hard to keep our mental health care workers public and not private. We passed a living wage to try to raise the wage of those workers. And maybe most importantly, we tried to take a big bite out of the uninsured population here in Washington County. Back when I was in county government, we had about 30,000 people who were uninsured. This was before the Affordable Care Act. We created something called the Third Share Program, which is a way for the county and employers and healthcare providers here in Washington County to meet the unmet health insurance needs of workers in our community. We were able to close that gap and reduce that number by about 10,000, 11,000 people. We were able to insure through Washington County's Third Share Plan, or the Washington Health Plan, as it became to be known. Now, of course, then years later, I had a chance to go to Lansing and serve as state representative, as was mentioned, from the city of Ann Arbor from 2010 to 2016. And because of the imposition or the creation of the Affordable Care Act, those third share programs were able to go away. But state government, the battle became, how do we make sure that we expand Medicaid? We've heard a little bit about expansion of Medicaid. Thank you, Anuja, for bringing that up. That was a very, very important expansion of healthcare service here in Michigan. Over 600,000 people here in the state of Michigan got access to healthcare for the first time, many of them in many, many years, through that expansion of Medicaid. And that was really the big win here in Michigan for the Affordable Care Act, besides, of course, pre-existing conditions and a couple other features. The idea that we could take 600,000+ people who didn't have health care and make sure that they did have it. We also were able to expand, this wasn't as well marketed, but we were also able to expand the state's Healthy Kids Dental Program. This is a really important program that provides dental service to indigent kids across the state of Michigan. And when I first got to Lansing, that program was a pilot program in 3 rural counties. Now, as of last year's budget, that program is statewide, and low-income kids across the state can now go to a dentist and get those issues taken care of earlier in their life, which makes a huge, huge, huge difference for long-term health care. The final issue I want to talk about, because we could go on all night talking about these important health care issues, is mental health parity. Not everybody knows that Michigan is actually a huge outlier in the area of mental health parity. Most states across the country have an insurance code that says if you're going to provide physical health care to someone, you have to provide a certain base level of mental health care. That's not so in Michigan. And many of us have been fighting for mental health parity for many, many years. We won a tiny sliver of it when I was up in Lansing, when we got mental health parity for just autism, folks with an autism diagnosis. And that was an important expansion, but we also need to cover depression and bipolar disorder and a whole host of brain disorders that would be that we should be treating under a policy of complete universal mental and physical health care. So in support of these issues, I'm proud of the work I've done, and I hope I have an opportunity to continue working on behalf of expanding health care so that we can get universal health care and we can get all of our leaders in Washington and in Lansing going in the same direction. Thanks.
And then we have Alexi Chapin-Smith, lead staff person for Ann Arbor Rep. Yusuf Rabi. She would like to say a few things about a universal health care plan in the works for our state.
Hi, my name is Alexi, and I do work for Representative Yusuf Rabi. Many of you probably know him. He's a real tall guy, curly hair. He has the job that Jeff recently had until Jeff was term limited. And so he represents most of Ann Arbor, except if you live on the north side, sort of north of Arbor Brewing Company. What Representative Rabi really finds to be the key issue here is just finding a way for us to provide health care for people that they need equally to everyone and without bankrupting people. And removing sort of the drag that this inefficient healthcare system causes on our economy. I think that the other speakers have really made a good job of explaining why that's so important. So what I would like to focus on is Rep. Rabi does have a plan to try and move us forward for figuring out the how. So for various reasons, it would be better maybe to do a federal universal health care plan. There's a lot of reasons why that would be preferable from a policy standpoint. But we're here in our state, and Congress is where it is right now, and although Representative Rabi is very supportive of the Sanders plan, we don't want to wait idly while we're waiting for the federal government stars to align and bring that to us. So he wants to articulate an alternative vision for Michigan, and again, in the Michigan legislature, we also have a barrier there. Quite frankly, we are not going to get universal health care through the legislature in its current composition. There is going to need to be a change in the majority party of the legislature. Just given its makeup. But we need to give people a reason to vote for that change. And what is the alternative? And so the vision that he has is a universal health care system that's going to cover everyone in Michigan and, be much more equitable and much more efficient. So he has, right now, bill request in, I've got it here. It is extremely complicated, so I don't want to get into the details unless people have detailed questions, and I will be happy to talk to you about those afterwards. But we're working on a plan to deliver single-payer health care, set up a system in Michigan, and have all the moving parts in place so that when we are able to change the composition of the legislature, we have a plan to put in place and give people an alternative to vote for. Now, this plan is based on the Vermont system, but with important changes. One of the most important changes is that, unlike the Vermont proposal, it is a publicly administered system. It does not use the health insurance companies to administer the system. So, we're going to take the profit motive out and remove these health insurance companies that are, quite frankly, they're siphoning off so much of our healthcare spending. The other piece of the plan, which is also in the works, is the financing piece. Many of these proposals in the states have sort of run aground on the shoals of financing, and so we feel that it is very important to have a feasible financing system to propose to go with the proposal. And that for Rep. Rabi, it's very important that it be a progressive financing system so that the burden does not fall harder on the people who can least afford it. We want the people who are most benefiting from our current financial system to pay their fair share. So we're working on a financing system right now, and that will be part of the proposal that he puts forward. They will be two separate pieces. The healthcare insurance system will be a bill But the financing will actually require a vote of the people of Michigan, because if you're going to raise enough revenue to fund a universal health care system, you're likely to run into the revenue limit that is in the Michigan Constitution right now. It's called the Headley limit. And so it would need to be changed by a vote of the people. We're going to take that opportunity to also create a graduated income taxation system to pay for this, including a capital gains tax, which also would require a vote of the people. So people will have an up or down vote on this, and we're going to need the buy-in of all of the people of Michigan. And for Rep. Robbie, he thinks that this is something that all Michiganders can get behind because it is such a basic value to take care of your family, to take care of the people of Michigan, that it's, once people get to learn about it, it's not going to be something that we can't talk about across the aisle. The problem being, of course, that that's for regular people. When it comes to politicians, I think we are going to need a change in the composition of the legislature. There's just not going to be a lot of working on this with people who fundamentally don't share that value. But we're going to work to try and flesh out this vision, make it a real practical alternative, and create an alternate vision for people to work towards. So that's what we're working on. The bill has not yet been introduced because we are still in the drafting stage, going through multiple iterations. As Margie mentioned, I was just at their board meeting yesterday, getting input from them because they've been working on this issue for forever and know the ins and outs of it, and talking about certain mechanical details of what would be the best way to run the system. And we are also seeking input from other folks who have expertise in these areas, and just trying to get a plan that will be the best articulation of the values that we share about providing care for everyone who needs it, and making sure that the system is workable and is a realistic alternative, so that people can have another future to look forward to. So.
Okay, now I'm going to have Alan Laurie come up with the Ann Arbor Social Justice Choir. They're going to lead us in a song.
Before we start, I'd like to say that 22 years ago, I had a ski accident, or I tore my ACL in a ski accident, in a country that has had universal single payer for decades, and that country was Sweden. And 42 years before my ski accident, Swedish people started marching down from the hills of Dalarna and Norrland